hope everyone is doing well. Thank you for joining us on the third installment of the Member Services Virtual Roundtable hosted by NIRSA. If you haven't been on with us before, just a couple of ground rules that we're going to go over. Please make sure you mute yourself if you are not speaking. Please use the chat box as well. For any questions, I have three other people with me. I'll have them introduce themselves in just a second, and they will be monitoring and asking questions. If you put it in there, it's fair game. We may call you out, so just make sure that you're ready for that if you put a thing in there. And then we're gonna kind of open the floor up today. So I'm gonna have my co-presenters introduce themselves, and then we'll open it up to all of you.
Go ahead. Whoops. We didn't plan for that. Sorry.
Hi, Victoria. I work at Clemson, Associate Director of Member Services and Aquatics there. Also super helpful if you hover over your picture and click on those three little dots, you can temporarily change your name. So if you'll just put whatever institution you're at after your name, that would be great. That makes things really helpful for when you're chatting in, or that way you don't have to announce yourself every time.
Follow up. I'm Taylor, Membership Services Manager at Virginia Tech.
Hi, I'm Melissa. I am Assistant Director of Operations and Fitness and Memberships at Southern Oregon University.
So we had a really good conversation last time. I think it left a lot of us thinking about a lot of different things. Just so everyone knows too, that fusion call that happened afterwards, Victoria did post the link to the recording of our Zoom call on the Member Services NIRSA Connect board, so you can see that there. I also see that MC is on again today, so if you guys have any fusion related questions, I know they're ready to field those for you. So does anybody have a burning topic that they would like to start off with today? If not, we can kind of go there, but we'll open it up to you first.
Anybody have a reopen date yet? No, me either.
Nope. Okay, so we got one. So what does reopening look like for member services where you are? Deonte, do you want to talk about where you're at in that process, and then we can get some other people to join in on that?
Sure thing. Hi everyone, I'm Deonte Screven from Tulan University. We're currently looking at having a tiered system of reopening, so allowing just the primary students and faculty and staff, and then opening up to the community members and additional members from that point. But of course, if you do that, some people aren't going to be happy, as well as that's a huge source of revenue that we're not tapping into by not allowing those groups in. So I was just curious as to what other universities are doing so that we can try and, copy.
I know at Clemson right now, we're kind of in that process of seeing what that would look like. So our EOC committee is asking us to format like several different possibilities, whether it's, limiting the number of facilities that we open, limiting the number of spaces that we open within our main facility, limiting the number of members, the types of members, are we just going to do students? Are we going to do students, faculty, and staff? Are we going to get rid of community members altogether? Are we going to phase them back in at some point? So not a whole lot of direction for you there with our school, but we're still kind of really in that planning phase right now. Connect too has kind of a really great risk management planning tool that they have sent out. So if you don't use Connect 2 already, you can still reach out to them and get that. It's like a return to rec risk matrix type thing. So we've been using that to try and plan out what the risks are in your facility and how to maybe mitigate them, or what the level of risk is there for different spaces.
I would say for us at Oakland University, we're kind of approaching it a little bit different. So we have decided whenever we reopen, we are going to go straight to whoever our current members were. So we are open to the community as well. So we have paying members plus our faculty, staff, students. We are doing extensions for everyone, and there's been kind of a little bit of a debate on what type of extensions we are going to do. Is it going to be based off expiration date because all of our dates expire at different times, or are we going to do across the board extension for certain memberships? So we are going to let in any current members. We are going to close off our facility to any guest pass users or any guests whatsoever. And then we will phase those people back in along with our new paying members back in as we continue to go through those phases.
I was just curious, this is Robin Embry from Stanford, and I believe that was, just speaking was Megan?
Yeah.
Yeah. I'm just curious what your rationale was behind guest pass users not being allowed access.
Yeah, so we actually closed off our guest pass users before we closed that day. I think our rationale was mostly about community members who hadn't already been in our facility coming from different areas. It probably kind of aligns similarly with our community members since they probably aren't on campus all the time, but we just felt like limiting the number of people through the doors. We do get probably about over 1,000 guest passes within like a month's period of time on a high day, or on a high month. So that is something we were trying to be cognizant of limiting like the number of people who hadn't already been in our building. I think that was kind of the thought process. And then also limiting like where people are traveling from to our building. A lot of our members, like we can actually track it down to like a 10-mile radius. So they already are in our county, but we want to make sure that we're not also contributing, I guess, to that community spread.
Okay. Yeah, I was just curious just because guest pass revenue is a big chunk of what we derive as far as individuals that are visiting campus, or whether it's a student, student sibling or parents that are coming to visit them. We derive roughly $1 million per year in guest pass sales. So that would be probably a no-go on our campus, but just curious what your rationale was. Thank you.
No problem.
I'll jump in really fast because Anthony from Central Arkansas had a similar question about making an RSVP list or one in, one out, kind of how people are addressing just the entrance and the exits at their facility, because that's something that I'm pitching. I would rather us have a cap at Virginia Tech and then manage it in our system somehow of an exit and an entrance just in real time. So anyone have any ideas and thoughts of what they're thinking about at their campus as far as pre-registering to get into the gym or doing a one in, one out system?
Well, since I posed that question, I will go ahead and say that one, we are obviously going to dive into Fusion like you would reserve other things on the portal. We might do that. Two, we were thinking about creating something like on the Google Form stuff where you can send people out, send them a link or put the link on our website and offer it up from there. I know there's a lot of debate going on right now. If you were at the director's one this morning about open for a time, close, clean, what do you do? What are the options? That's a whole nother debate. As far as in and out, you got to kind of also deal with security and safety from there because, if you don't, most buildings are going to probably have like one or two main entrances where you can come in and out. After that, you're talking about should you open up an emergency exit door? And then, of course, what is your emergency exit door tied to as far as alarms or notifications?
I brought up the one in, one out in a meeting with our team the other day, and their issue with that was that may not do anything for the specific spaces. So if you are only letting one person in and one person out, you still may have 100 people in your main fitness space, as opposed to 5 here, 5 there, 10 there, 10 here. They may all still be going to the same location, which doesn't really help at all. So don't have any really words of wisdom, but that's something to keep in mind of. One in, one out may not be the best solution. It may be if you have, if you do facility counts, keeping track of that. And see if people are doing swipe in and swipe out of a facility, and you add like a max capacity, can we track those things through Fusion?
So yes and no. So we do have the swipe in out, and they do correspond. So if you, Victoria, swipe in and then you, Victoria, swipe out, we do know that you left and we know how long you were in. We don't have anything currently visible in Fusion to tell you that without running reports. Query Builder could come in potentially with an assist, but we are currently working on what might be best for our clients to present that information up front and center for you to know what's going on where.
Yeah.
And what that might look like configuration wise for you too.
Yeah.
Victoria, you're gonna get
oh, sorry. Hi.
I'm sorry. Hey, you're gonna get an email from us by Tuesday of next week, giving a date that we're expecting to be able to show you the live count of people in your facility based on the requirement that you have that entrance and exit swipe configured. But that is top of mind for us right now, as we've been listening to the webinars and to hear how important that is to everyone. And we're anticipating, just to give you a preview, we're anticipating having that for you by June.
Great, that's awesome. Thank you.
Is Isaac from UCSD on? I didn't see him. I only brought it up because Anthony asking about a way to use Fusion to do space reservations. We got a ticket from Isaac earlier in the week and worked with him. He actually made a video for us based on what we showed him to do using programs by schedule to create kind of a graph for people to register, you to track capacities, and people hold their space for hours at a time, so that you can let people pre-register to come into the facility. So that video is in the works, and it'll be on the website at the end of the week to show you how to, that's current functionality and a way to do that if you're interested.
So real quick, Pam, I have a question about that, what you're just talking about. Correct me if I'm wrong, you have to, that means you also have to open up onto the portal, and you got to be able to be part of that, correct?
You do have to use the portal, yeah, to do that, for people to pre-register for those spots. That is correct.
Thank you.
Sorry to jump in, Victoria.
Oh, that was great. Thanks. Yeah, absolutely. I didn't see that you were on here too. So lovely.
There is some discussion in the chat. Brianna, do you want to talk about your guys' approach at Grand Rapids, about your approach of having staff members stationed in each area to do counts?
Yeah, so we have a much smaller facility, obviously being a community college. So we don't have a lot of people consistently in, but we were talking about trying to figure out putting a staff member in our fitness center, because we do have scanners on the doors. So people do have to scan in to get into the facility themselves. So that's hands off and is a little bit better than trying to get them in and have our students looking at cards. But we might be putting a student within the fitness center just to make sure that people are keeping that distance. And then with that, I can't remember who said it, but not knowing how many people are in each area, and like one area might be more popular than another. We talked about removing some of our equipment, which is going to be a big project, but if that's what we're going to have to do to keep the guidelines correct and keeping the spacing consistent, we talked about putting some of those machines into storage so that people aren't breaking those rules, and we can space out the treadmills, for example, and make sure that they are spaced out enough so that they can do their workout properly without worrying about that distancing.
At Southern Oregon University, we're also a pretty small university, and we looked at the one in, one out model and staffing for that. And we thought about having a staff member in every area. Not only do we not have a lot of students who go to the school, but that also leads to like, are we going to have enough staff to be able to accomplish that? And if we don't have the staff to do what we need to do to make sure that social distance happens, then are we going to cut our hours so we can have the staff? So we still want to be able to offer the gym to our students who will be on campus, primarily the students, and then the faculty, staff, and alumni and community, but students first. And then we're still trying to figure things out at SOU. A lot of ideas that have come up here, I'm writing them down, taking them back to my director, so it's gonna be great. I saw something about if we're going to do the one in, one out in the summer. Right now, we don't have a date when we open. I hope we're gonna open in the summer, but who knows right now.
Just a quick jump. Robin Embry asked, oh, sorry, wrong person. Sharon? Yeah, Sharon Murdoch from West Texas A&M asked if anyone has other offices or classes housed in the facility and how they're keeping track of maybe people navigating around the facility if they're not there specifically for the gym. So Sharon, if I'm wrong on that, please jump in. But we also have our wellness department and some classes in our facility also. So that was a great question. I thought maybe we could talk about that.
Yeah, at Clemson we do too. We have not only our Healthy Campus, but also our campus banner and design, which is all of the marketing for student affairs, as well as like across campus. I mean, they do all the things. So they're both housed in our building. Thankfully, the way that our building is structured, they essentially come in a side door and go up to the third floor, and that's really it. But especially with campus banner being there, that means a lot of people are kind of coming through to pick up items like printed items and stuff like that. So that's actually something I had not thought about that I definitely need to add to my list of things to bring to my team.
We have the PE classes, aerobics classes that happen in our facility, and I have started communication with the athletics coordinator who is over those classes, and just trying to work with her to make sure that her instructors they lower their class size down because our spaces can't grow. So I've talked to her about limiting her class size and or finding an alternate space that's bigger. So I think that just working with the groups that collaborate on space usage of the facility is the best way for us to go at this point at SOU. Unfortunately, there's still a lot of unknowns.
I think something interesting that got brought up in our all staff meeting yesterday, I know a couple of my coworkers are joining me on here, and I'm not sure if they were as shocked as I was, but potentially campus looking at having some of those larger lecture-like classes start taking place in our gyms. Since we have some of the largest spaces, and what does that look like? You talk about managing them in our building. How do you make sure they're leaving and entering, and how does that help us manage that? And then also, how is that impacting our open recreation and our reservations, career fairs? Like it really kind of throws a whole different mix into our world, and that wasn't something that I even had thought about until yesterday. So campus is definitely looking at us, which is great. We want to help out, of course, but it's kind of gonna be one of those last minute decisions that gets maybe put together a little quickly. So I'm not sure if anyone else is seeing that as well, and kind of how you're maybe planning for that.
At SOU, we're also planning and trying to be prepared for requests to use our gym space, because it is probably one of the largest spaces on campus to use. We did have some communication before we closed about using it for finals for our students to take tests. And we're ready to do something similar to that. Since we put the plan in place before we figured out where to place the tables and chairs to maintain social distancing and everything. So we're prepared for that, but we're also know that we're probably going to get those requests as well. It's a blessing and a curse to have our facility.
Yeah, I would say this. So we got an email from the university about maybe 2 days ago now, talking about using bigger spaces like our banquet rooms and stuff at our university for classes. But then I asked the question, did we think it was going to come down to our basketball courts? We already host classes. We had buildings offline on campus that building projects are either going forward or they've been halted. So what is that impact? And I think it is very interesting, the conversation of like, how at membership are we going to decipher that? Like, could it be more of, if they're coming in for a class, instead of scanning the card, do we do it as like a daily visit for that class? Like it's just an individual, like a facility tour or something like that? Or do we switch it to scanning it so you can differentiate who's there to work out and who is there for class? Now getting them out of the building after class, now you don't know if they're working out or not. So that is something to consider. But just an idea to throw out there, if there is a way to differentiate why they're there, then we can maybe have a little more accurate facility counts for ourselves.
All right, I wanted to chime in and just ask, I put it in the chat, but I haven't seen any replies to it yet. I don't want to assume that everyone is operating under the assumption that those individuals that be coming into our facilities once we reopen are all testing negative, but how has there been any discussion around how we vet those individuals that are coming in, that they aren't positive? I was looking at some of the guidelines from the 2 states that released information. I think it was Tennessee and Alaska. And one of the stipulations for Tennessee was that they were going to suggest barring entrance for anyone that has a fever, which obviously brings up the next step. How do you determine how someone has a fever? It's got to be probably a temporal scanner or something of that sort. But I'm just thinking about how do we vet an individual and know that they aren't contagious, that they don't have the virus, or that perhaps they have some proof that they've tested negative that would allow them to come in. Has there been any thoughts about that in anyone's department or university?
We have thought about that. We're working with our Health and Wellness Center, who is working with the county government and state government health departments about what are the best options to letting people into our facility. I mean, there could be asymptomatic, people as well coming in and bringing it in who won't even have a fever. And then there are those people who will go for a run before they come in to lift weights, and they're going to have a fever because they're going to be hot. So it's just kind of still, there are yeses and nos for that. I don't have an answer, unfortunately.
No, I agree. I think it's a very challenging question because none of us want to be the place where another spread begins because we didn't have a proper system of vetting people getting into the facility. That's the biggest thing that's keeping me up at night right now is great. We can open the door, but we have no verification. We don't know, in general purposes, anyone's health history when they're walking in the door for the first time. And especially with a contagious virus like this, that's why we are definitely taking the slow approach to it, hoping that there will be either extensive testing that would provide people with some type of proof or verification that they are not positive, or, vaccine could be 2 years away. We don't know. And so that's one of the big discussions that we have on our plate as far as being operators of these facilities. We simply don't want to open up until we know that the transmission risk is very minimal, or non-existent. So at any rate, thought it was an interesting point that we just need to really nail down.
Robin, I thought it was also interesting. I sat in on just a director's meeting earlier today, and it was very interesting to hear a lot of them at that level saying, you know, we need to be careful too of what we take off and say we're going to do. I mean, we're in recreation. We are not medical professionals. You know, are we capable? Are we trained to do that type of testing? Are we, you know, can a student employee be able to judge that someone, you know, should or shouldn't be allowed in? And then if you're saying you're doing that and someone gets through, you know, then who's to blame on that? Well, we had the protocol, but the person got in anyway. So it was very interesting at that level that the directors are very much saying that we need to be really careful what we take on. You know, we're going to do our best with what we've got, but we also need to do it within our scope of, you know,
expertise. Yeah.
Excellence. Yeah.
Yeah. Yeah, no, I agree. Hi, T-Rex. Thanks for the feedback. Yeah, that's just one of the things that we, you know, don't have a great answer to at this point, and something that is a big consideration for all of us.
Yeah, well, and I think you can go.
I was just saying, yeah, we're not healthcare professionals. We're not trained for that, and if it comes down to them saying your students need to do this, I'm frankly going to say no, because I don't want my student to be the one that says, well, one, that's putting them at risk for being that close to somebody. We don't have this mass testing yet. Clemson is a huge school. There's no way if we let students back on campus that we can require everybody to get tested, but whether it's from their personal practitioner or health services on campus, everybody would just be flooded. And then that's putting them at that additional risk going to a healthcare provider to then come back, all those potential things. You know, it's just, I think that that's something that we're just going to have to work on with our facility staff, our operations staff, making sure that we're double, triple cleaning everything, you know, making sure that we're mitigating the risk as much as possible. You know, and I would hate to have my staff or me scan somebody and be like, oh, you're a little bit on the borderline. I'm not going to let you in today, when that person is totally fine. And then have the stigma of you've got coronavirus around that person.
Yeah, I think I would echo everything that you just said, Victoria. I would not feel comfortable putting my students in that position since they are not medical care providers. I mean, we all, you know, they're all trained in CPR, but that doesn't mean they're trained to tell someone that they can't enter a facility due to possible infection of this virus. So I would agree with that. I also think like there is possible that this is an unpopular opinion, but I think when it comes down to it, we're going to have to communicate properly the risk of coming into our facility. And also people have to understand there's a risk anytime you leave your house right now. So it really is putting it back on that member when they come back into our facility. If we're saying you need to wear a mask while you work out, you need to wear proper PPE, you need to clean your machines, you're taking on that risk yourself by coming in. Now, is that, you know, fun and great thing for me to say? No, but at the end of the day, we can only do so much as a facility when this is going around. So we do have to remember that there is risk put back on the people coming into our facility.
Yeah, unfortunately, that's one of the terrible things about all of this is you have to rely on the stupidity of others sometimes. And
I think, because obviously we're all talking about this too at Tech and figuring out how we're going to manage this and the phases we're going to manage it. And now that we're talking about this, what my director is hoping for is not this insane reopening or anything like that, definitely phasing it out. But during that time, just communicate. I mean, really, really, really pushing communication of what is safe, what's not safe to our members and just to the greater Blacksburg community, just to make sure that people are fully informed before they take whatever risks they want to take leaving their house or coming to our gym. So heavily relying on social media, our website, signage outside, like physical signage when they walk in the doors, just really taking a big jump on that. So I don't know if that helps, but.
So Monica in the chat mentioned something about waivers or assumption of risk forms. And I was actually thinking about this too, because we're talking about risk and we're saying that, you know, patrons who come in, members that come in need to understand that there is a risk. Is anybody else thinking about maybe having a specific assumption of risk or waiver for COVID or adding that into their existing or creating a new one? this is something that I actually plan on talking to my risk management about at the university and our legal.
Yeah, I agree. And just to be clear, I wasn't advocating or suggesting that our staff be the frontline people checking people's temperatures and doing those type of things, because we're not trained medical professionals. I was just stating that, and I posted in the chat now, the guidelines from the state of Tennessee regarding exercise facility consumer protection. Screen customers for illness upon entry, the best practice, temperature checks for every customer, minimum, some questions regarding COVID-19 symptoms, and so on. And I was just wondering if anyone else has thought of those, because that's in an actual guideline from a state for reopening this type of facility. And so I was just bringing it up because I just hadn't seen any discussion around it on this particular roundtable.
Oh yeah, we definitely in our staff meeting this morning talked about we can move forward with these phase planning as much as we want, but until we get those guidelines from the governor and the state, and even possibly our counties here in Michigan, we're not going to be able to do finite planning and even know if we're going to be able to provide the safe environment based off of recommendations. So I think it's totally a fair question. So no worries on that. I think it was a great conversation starter about that topic.
Mm-hmm.
So there seems to be a lot of chatter about towel service. I feel like some friends maybe want to jump in on that, talk about what you're doing, whether it's free, paid, who's laundering them, continuing it, discontinuing it.
Hi, this is Cream from West Virginia University. I initially asked the question because I inherited member services on the 23rd of this month, and found out that we do like a full-on laundry service. So like we wash patrons' clothing in addition to kind of towels and things like that. So I'm just trying to get a gauge of if anyone else does that. I've not heard of it before. So when I think with a lot of people ending towel services in general, I think this is a good opportunity to potentially end both of those services, but just wanted to see where other people were at with that. So thank you to everyone who has put stuff in the chat. It's been helpful.
I would say that laundry service gotta go. So I think some other people put that in the chat. Yeah, I know a lot of people are discussing, and I know Taylor, you added in the chat that you guys are discontinuing laundry service. Do you know if you're gonna continue it later on, or is it just something temporary?
I think it's temporary at this point. I just know that we're not going to do it early on. That is for sure.
We provide free like workout sweat towels for everyone. We have a paid locker service or towel services, like, you know, the shower towels, but we've been trying to get rid of the free sweat towels for years, and the university just blows up every time we do. Not blows up, that was terrible, I shouldn't have said that, but get very angry every time we do. And so we're thinking that this is going to be a catalyst of like, hey, switching to gym wipes because that's what we need. You know, if you want a towel, bring your own, you launder it, you take care of it, not something that we want our staff, because, you know, think about the staff that are collecting, that are washing, that are folding, that are putting it back out there. You know, most of the handling for member services side is after they've already been laundered, but there's still those people that come up and say, oh, I forgot to drop this in the towel return. And
I know another topic that was brought up in the chat is about member promotions and upon reopening, or when you will be selling memberships again. So I wanted to open that up to everyone. I know we kind of talked about like kind of phasing people in different approaches, but do people have plans for promotions or what they're going to be doing? We're thinking about a coupon personally. So looking at potentially a 20% off coupon for all current members. And then once we are reopened to the community, potentially a referral program to kind of get back in the swing of things. Just like Robin mentioned, for their guest passes, our memberships are our primary income at Oakland University, along with our facility rentals. And since both of those are being threatened right now, it is a little scary on the finance side to think about. So I think we are looking for ways to re-engage once we are able to.
And Megan, that's in addition to extending their current membership, then as an additional incentive, it's that 20% off, correct?
Correct. It is a goodwill measure.
Great.
Quick question. This is Dejanay at UC Davis. This is actually my question, and I mainly asked it because, like, typically we would do membership promotions and we would try to like increase participation in other program areas, so like group fitness or, you know, intramural sports, etc. And right now, given we don't know when we'll be opening up those, we're not looking to try and like include that in a membership promotion. So we're looking specifically at, of course, like most of you, membership is a big help for our department, and so we're just looking to see any creative ideas that, I mean, if it's like, you know, like a 99 or a month to month promotion, we tried to get away from that, and so we no longer offer monthly memberships, but we're thinking about maybe, you know, bringing those back or potentially posing those just to try and help with the revenue loss, and of course, you know, try and make up the members that have decided to leave. We know that, of course, COVID-19, like, people are going to take their own risk and come back or not come back, but any type of feedback or ideas would be greatly appreciated.
I think, you know, it's really going to just depend on what phase you introduce that into. I wouldn't necessarily, just on like a personal level, and this is why we're doing what we're doing in membership at Oakland, like, I would not feel comfortable inviting more people into the facility more than what we already have, even though we want to increase and maybe regain some of our revenue. So I think the 1 months are really interesting. Obviously, we kind of talked about this in the first call. Be wary of the 1 months and how you do them, because you're going to have different expiration dates, and depending on, you know, how things play out, you could be extending differently. We're dealing with that issue right now. So I would just say, in general, like, if you, Group X is normally, you know, a part of your selling point for your membership, that might be not, you might have to rephrase it. You may also do discounted memberships based off of what you do have open, because I think we're all going to have very limited capabilities as a facility. So that's just a thought for me.
Definitely. Thank you so much for sharing.
Has anybody been approached about redistribution of staff? So one of the possibilities for our facility is not opening everything all at once. So, you know, leaving our pool closed, our climbing wall closed, basketball courts closed, which then leaves some of those staffs open to do different things, like be the guardians or the bouncers of different facility areas, or, you know, things like that. Has anybody else had those conversations yet? Or how you, amongst your staff, you know, traditionally we have 2 to 3 working at our welcome desk. How are you going to be spacing out your staff, protecting your staff, those measures? Have you guys started having those conversations yet?
This is Anthony from University of Central Arkansas again. We have you kind of did the math. What do you do on the basketball court? You know, you got, you know, all your variety of things, including the volleyball, the badminton, things like that. So we're going to close that down. So that'll help us from there. We're going to close racquetball down from that standpoint. Pool is up for a debate to also include, we're getting guidance from the Department of Health on our classification of our pool. Do you need 1 lifeguard? Do you need 2? From that standpoint, our challenge course is going to be closed as well.
If you need help on those pool reclassifications, let me know. I've had to do those.
Yeah, we have the manual, and our aquatics coordinator is actually emailing them and going, hey, remember us, here's what we have. We just need a little bit more guidance on 1 or 2 lifeguards.
Oh yeah. And they're done that. What else? What else y'all want to talk about today? We want this to be productive for you guys. If anybody's got a burning question, concern.
So I'm going to jump in. I can't remember who it was. Probably about 5 minutes ago, she mentioned moving equipment around, things like that. So one, we did that because we were closed to clean parts of the facility. So if you're going to do that, you've never done this before, get with the physical plant on dollies, pallet jacks, pallets. They help move heavy equipment very easily. The other thing is that if you are moving cardio equipment, that you plug into the wall, remember that when your facilities are built, they're typically built for dedicated outlets for 220 or 110. So if you find the corner over in your building where there's an outlet and you think you want to plug your treadmill into that, you probably want to talk with your physical plant electrician and make sure that it can support that 110 or 220.
Hi, I was the one that put that on there about moving the equipment. So we were looking to figure out to put the equipment on, but it was not going to be cardio equipment because of the power problem, because of the power issue, exactly that. But we're thinking of putting some of the equipment in the field house, sort of like almost like a circuit training, so they're far enough apart from each other. But at least gives them an option, because otherwise our weight room area is just way too small to have anybody in it. So any recommendations of exactly what to put the equipment on to protect the floors?
Does your university have, like in the physical plant, when they have special events, like graduation, do they have some kind of a floor covering that they put down wherever that might take place, and you can borrow that for the time being?
No, we don't. Right now, the only thing we do is we make sure if there's any chairs or tables that they have, the rubber on the bottom. If there's been events with bounce houses, we put a large tarp, which again would not prevent from the weight of the equipment. So that's why we're thinking maybe, tarp / plywood, something like that. So, because our flooring is, squishy, it's not hardwood or anything.
We have been told by our flooring companies to do like plywood, so tarping them and then doing plywood to kind of more evenly distribute the weight, which then means you're, spending that budget money out buying plywood for a temporary solution. So, but
that's what we're thinking too, tarp and plywood.
Yep. We've had to do that before when we've like either rearranged stuff. I hadn't thought about asking facilities if, other facilities, obviously they're not going to be using the basketball arena. Hey, if we need that, can we borrow yours? I hadn't thought about that. That's a really great idea.
Yeah, we're thinking about that too. We're supposed to be getting a new facility for athletics, but that's been postponed. So we don't know really what's going to happen with that location. And they have obviously large hardwood floors in there. So that's definitely a question we're going to propose.
Yeah. Pam or MC, it looks like we got a question about automatic emails. If when that query is run to extend membership dates, the end dates, is there a way to automatically email folks, or would that be something that you have to generate yourself or like program to send out?
It wouldn't automatically do it. You would need to generate it yourself. That query includes a column of email addresses. So when you've filtered it and you're about to do the import, you might want to just copy that column and use that as your list of who to contact and let them know. Because it's kind of like most people have said, there's not it's not everyone in the query that's getting adjusted. You're picking and choosing certain membership types or getting certain things differently. You could use the communication tasks to build in certain parameters and email people a certain way, but I would just personally, if you're already doing that query, probably the easiest thing is just to copy the column of email addresses and send your own email.
Yeah, and if you didn't have a chance to hop on the call that we did last week, 2 weeks ago, with Pam and MC and Christy, they actually showed us how to use the query builder to run those programs or run those queries, and kind of how to send that out and copy the code into the chat and everything. So that's the link that I sent out in the member services email thingy earlier this week, last week, Friday. Losing track of my days.
And if you missed it and you want to reach out to us to help you do it. I'll put an email in the chat. You can just send an email and say that you want help, and we'll get on a call with you and do it individually too.
There was a conversation in the chat about opening locker rooms and if people are going to allow the use of locker rooms. There's a lot of conversation already going in there, but I didn't know if anybody wanted to, if you are planning on closing your locker rooms, do you have what you're going to communicate to your members to justify that? Or what was your decision making on that?
Well, so I'll wait for the customary 3-second pause there and to jump in. And Teresa, I think that this was part of that conversation as well. And help me out if that was in the directors meeting. This goes along the lines of the, you know, how many people do you let in the building? Do you check the temperatures? Do you require the mask? It's one of those that you got to kind of debate, what is it for? And I think I remember some of the conversation was literally you're going to go in there, you know, you put the message on the door and it's go in there to use the bathroom, wash your hands, and then you come back out. There's no showers. There's no locker rentals. There's nothing like that.
Yeah, I think that's one of those big questions that we're all like, with right now.
A little cringy.
Yeah. I know our people that have had their same locker for 40 years would lose their minds if I told them they could not access their locker.
Well, and I think on that, you know, you do have to take in consideration, those of you who are thinking about closing your locker rooms, how you're going to preserve that on the customer service end. Like, I know we have members who've had their lockers for the 20 years that we have been open, and they do not want to lose their locker. It's in the right proximity to the showers and the front door and all of that. So I would encourage anybody who is not, and I think we're kind of leaning towards that way ourselves at Oakland, to make sure you have a customer service plan for that, if it's leaving it on people's accounts. So then when we do reopen to normal, that we are still taking that into consideration, because as I mentioned and Victoria mentioned, like, we will have those, maybe the more vocal members definitely state their opinions on that, and we know it will go to our front desk staff and not necessarily to us, or to us and them. So
yeah, Megan, I think your advice just about the communication piece on that is big. I mean, they know we're not just opening up the doors and it's back to business as usual. I mean, everyone knows that. It's not that way with anything that's happening. So, I mean, we just need to explain to them, you know, we're phasing things in. Right now, we just want to get people back in here, exercising, feeling good, you know, getting back into their routines. And, you know, don't worry, your locker will be there when we open them. But, and I brought that up first in the chat just because that is really one of those with the locker rooms, you know, because you start thinking about the access to other things, and most people do have their restrooms inside of the locker rooms. So that's obviously something we've got to give people some kind of access to. And, you know, I did like, you know, the direct sign, and you get 1, 2, 3, you know, 1, you come in, use the facility, wash your hands, leave. And, you know, they'll just have to get used to that during this first phase of reopening. It's not going to be like that forever, but I think the communication piece of it's going to be huge on those type of things. I'm less afraid about my locker rental people than I am about the pickup basketball players. Mm-hmm. Those guys are going to be irate. I mean, that's honestly one of our, as I know for most of us, the biggest open recreation program is just people coming in to play pickup or shoot around. And, you know, we've already talked about, can you trust someone, you know, with one ball to play on one basket by themselves? Not normally. So, you know, will we be able to control something like that? Who knows? But, you know, and again, it's just going to have to be those conversations. I mean, we're not just throwing the doors open. And they'll realize that. May not like it, but, you know, I think we can explain it enough that it'll sink in.
Robin, I like what you put in the chat about, is there a greater risk in particular in locker rooms than the other parts of the facility? And the only thing that I can think of that makes it like a more high risk is, one, because people are storing their potentially sweaty, nasty, disgusting things that they wear over and over and over again, unless you got laundry service. And because they're in such close proximity to one another, if me and Megan and Melissa and Taylor all had lockers together because we're friends, we're all going to be right there in that same, 12, 14-inch space at the same time. So I think that that's why that's kind of a big consideration right now. Not necessarily that it's higher risk, but.
And I mean, the one big one too, of course, it's much more difficult to monitor locker rooms. I mean, being out on the floor, watching the weight room, watching, cardio areas, we can do that. I mean, we're not going to sit in there and watch people getting undressed and, getting dressed and then saying, no, I'm sorry, you can't stand that close to that person. That to me puts us, I would not want to put my students in that situation. So, I think of it as the enforcement piece of it, of trying to keep people away from people. And, like you said, the benches and the sweat and everything.
Yeah, I get all that. The situation, I know that you have this situation at Chico State as well, is our locker rooms are attached to our pools. And if the pool users are wanting to swim, and we know they will want to swim, do we say the pool is open, but you can't use the locker rooms? Doesn't seem practical to me. It seems that the pool would need to be closed too if we're saying you can't use the locker rooms. Someone sopping wet out of a pool, we don't want them traipsing through the rest of the building to get back to their car. So how do we monitor that? They have to dry off, but they can't change out of their wet swimsuits? That's my question about the locker rooms. I agree with you that they're all in closer proximity and there's more ability to exchange virus if they have it, but how do we monitor that? Are people going to open pools or not? It's almost a non-starter for us because I think pool use is definitely going to be desired.
Yeah. I know we're talking about not opening ours. It'll be one of the last areas to actually open.
So we have about 9 minutes left. So if anybody else has something they really want to talk about, I don't see any raising hands. I'm not locking anyone down today. So if anybody has anything that they want to bring to the table, we would love to hear it now. Throw in the chat as well. I think, as we know, this is just going to be an ever-changing situation, and we're definitely going to have to go with what our, I think I mentioned this last time, but it's going to be, what is our university doing? What is our state doing? And then also possibly even our counties. So anybody else have anything else today?
I have one thing, Diane Gutierrez, CC, Shannon, Barbara. I'm wondering if anyone is putting a deadline on when you can receive refunds. So kind of like, okay, if you don't submit a refund by this date, then you will automatically receive an extension.
We are doing that at Purdue. So we're allowing them to request it by May 30th. And okay, that's kind of a two-part because we want to get it in by this fiscal year at the end of June. And then also it gives us time when we do reopen to actually make sure we have the extensions and everything kind of locked and loaded. So that's what we're doing right now. Obviously, if we're closed a lot longer for some reason, we could change that. But right now it's May 30th.
Thank you.
We asked our members, we gave them an option to choose if they wanted a refund or an extension, and then there was a timeline on when that submission had to be submitted, but if they didn't respond, we just defaulted to a refund. So kind of the flip-flop of what you were saying, of defaulting to an extension, we defaulted to a refund if they didn't respond.
That's also how we're doing things at SOU. We're defaulting to an extension. So I have had 2 people ask me for a refund out of all of our members. So.
Okay, so Mike Chadee just asked in the box how, with us with locker rooms, how it's going to affect our usage, because a lot of our faculty staff use it midday and assume that they can shower. So how is that going to affect our membership? I think that's a really great question. I know we're a very high user group around the noon hour for group exercise classes and just a main workout for our faculty staff. So I do think that actually may bring less of our members in, and that could be a concern, but I think at first that may unfortunately benefit the limit of people in the building.
Yeah, I agree with that. I think for us, it's just more thinking about that process of, like, we've currently just suspended our membership payments. You know, anyone who's on payroll deduction or automatic credit card is just, we stop those payments while we're closed. And then when we get back to that point of reopening, we can't if we're going to limit those, you know, we're not going to have locker rooms open or whatever the limitations are, that it's going to be, and I'm sure everyone else is thinking of this too, they presenting, here's the way we're going to open, now giving those members the decision of, do you want us to start your membership back up, or do you want to hold off for now because of these limitations?
Yeah, I think that's definitely a good question. And I think that's why, so for us, we've decided to extend everyone, but we're not putting an expiration date right now on refunds, just because we don't know if the offerings we're going to offer are going to suit the members who want to come back. We also have thought about potentially allowing members to start their extensions later on if they're part of those high-risk groups or they don't feel comfortable coming in. So I think, you know, obviously it's always a continued conversation when it comes to that, based off of what we're offering, when we're offering it, and how. So.
And then just a reminder, if your facility has like a single user locker room style thing where, you know, we've got one, unfortunately just one, but it's got a toilet, shower, sink, everything in it, definitely something that you can also utilize where it kind of cuts down to that one user at a time.
Okay, so we're coming up to the end of our time. We have, like I said, about 4 minutes left. So if anybody has anything else, NIRSA has decided that they're going to extend these into May. So if you guys want another one, I know we're all, again, willing to host another one. So definitely let us know. We can, you know, post a poll in the Membership Connect or whatever we want to do with that. I think, as you know, we've talked about it many times, but it's going to be a rolling situation, and obviously continued conversation doesn't hurt. So.
All right. Thanks, everyone. Hopefully we will see you again soon then. And as always, if you have topics ahead of time, I think Megan is normally the collector of those, so feel free to send them to her or just to send them in the member services thing. So.
Definitely. Thank you guys, and great to see all of you. Hope you're all well and safe, and continue planning.
Thank you. You've all given me a lot of things to take back to my director. I appreciate it.
Hi, everyone.